So what are you doing now?
What am I doing?
Yes,
I'm doing adjustments with what's called the Vetro Stim, and this is a stimulator to the joint to allow joint movement that is putting the pressure into the vertebral segment in between the one above it and the one below it so that we can reduce what are called the fixations of the bone. A bone fixation is also called a subluxation. Means the bone is not sitting in its correct position, which is thus putting pressure onto a nerve possibly or a blood vessel, which is then giving a distorted posture, and the muscles will react to that posture to guard. And what we're trying to do is we're trying to recreate movement, and so we go through each of the spinal segments with this little impulse device and create movement without putting any kind of pressure or any kind of twisting onto the joints. So it's a very gentle and easy technique. We start all the way up at the top vertebrae called the atlas and work down each spinal segment throughout the neck, into and between the shoulder blades, all the way down the spine. And each one of these impulses is an actual adjustment, but it's without a lot of force. So the nervous system can adapt to this very quickly without going into a
like a stress mode.
fear mode or a stress mode. This is a much easier approach. And you'll notice that the dog is not reacting in any negative way. They like the feeling and they do not look at it as a fearful event or a harmful event to them. Otherwise he'd want to get away.
And she's 16?
She was 16 on Thanksgiving.
Okay.
Yeah.
And why did you bring her?
I brought her because she was having some problems with her movement. You know, her back legs and stuff like that. We had another dog in the house that died on November 2nd. So they have been together. She's 16, he was 15. They've been together all that time. So she was going through a period of grief and, you know, stuff like that. And when his last month or two, a lot of attention had to be paid to him. So she got kind of short shrift, you know, on that. So it showed up in physical things besides her age. So this has just been marvelous, you know.
And what changes have you seen?
I've seen that she has more mobility and everything, and she's more at ease in her own skin. And where I take her out for walks, now she's showing interest in the surroundings where before, see, dogs or animals don't show much pain or stress or anything like that because years ago if they did that, they became prey. They were down at the bottom of the food chain, you know. So anyways, they're very stoic, in other words, and so you don't really know a lot of times when they're in discomfort or pain, but now these subtle changes have let me know that she's doing better.
And what's her name?
BJ.
Okay.
That's short for Brianna's Jewels. Her mom was Brianna.
And what kind of dog is she?
A Cocker Spaniel.
Oh.
And she's a very sweetie. Okay.
You don't want your picture taken? Are you ready to go? Here, let's get your harness on. Come here. Come on. She might have to go to the bathroom too. Come here.
Yeah.